And what kinds of things can we look for? Because incapacity is not always that obvious. Remember that if you've met one person with dementia, you have met exactly one person with dementia. Okay, we are all unique creatures. We have unique brain structures. We have unique body chemistry. And even though you may have somebody who you say, well, this person has Alzheimer's. My grandmother had Alzheimer's. I know what Alzheimer's looks like. No, you know what it looked like in your grandmother, but it's going to affect different people different ways. Now, there are certainly themes. Obviously, that's why we can make a diagnosis. There's certainly things that are going to be similar, but just because one person, I've seen Alzheimer's patients that were very easygoing and lovely to work with. And I've seen Alzheimer's patients who just started for no reason at all, became some of the most hateful people you've ever wanted to deal with. And the worst part is they couldn't understand why. So the obvious signs, we look at short-term memory loss. People who they don't remember their words. It's described as word salad. Now, this is one that's really less obvious, but it's a really good indicator. If you're sitting with a person who may have an incapacity and they're older, and they do it without thinking, and we do it if you're in a relationship. Honey, what did I say? Where did we go last week? But for somebody who's older, we're dealing with an incapacity, you need to have them answer the question, so that particularly if they're with their kids or maybe they're with their spouse. And I've been known to say, I'm sorry, I need your spouse to answer that question for me. All right. Don't look at your son, look at me. And then we can ask your son, but I want you to look at me and answer that question. Because there's a difference between just, conversation, but people, once they have dementia, they can get really good at covering for it. And it's and our brains are fascinating. Our brains are just amazing as to what we do and don't understand, and how our brain will protect itself. Trouble staying on topic. Again, that's another sign. If suddenly they can't carry on a conversation one way or another, it could be that they're always like that. That would be me. But if it's something new and different, then we're probably looking at, it's again, one of those red flags that says, maybe we've got to look at something here. Comprehension problems. Again, repeating questions, what happened? That poor memory, poor ability to understand. A lack of mental flexibility. This one, again, can be really challenging because is this person just being stubborn, or is there something preventing this person from thinking about this problem differently? There's many ways to accomplish, well, we can pay this bill this way, or we can use this method or this method or this method. No, we can't do that way because we got to do it this way. Well, why? Can we do it this way? We're having problems this way. No, it has to be done that way. Okay, that's a rigidity to thinking. And that can be, again, somebody can't just be stubborn, but if you look at it in context, it can be a sign that they're struggling. Again, another one that's really easy to see is an inability to perform math calculations. Usually, typically, not always, but typically when we see somebody with dementia, and I've confirmed this with other professionals, executive function, our ability to get from point A to point B and understand those processes in between, A1, A2, A3, A4, that's what they call executive function. And that's typically where you're going to see that first impairment. So somebody's struggling to pay their bills and numbers and money and things of that nature. That's also really common where we start to see the dementia. It typically appears in somebody's finances. And that's why you'll see people who don't pay the bills, or they can pay their bills regularly, the ones that they've been paying all the time, but they struggle to pay anything new. Or if there's a change in circumstance, a bill used to come by mail and it now comes by, or came by the internet, and now it comes by mail. So some of them will get paid and some of them won't. So again, that's the, but that inability to perform simple calculations. One of the tests that's performed, the Montreal Cognitive Assessment, and I think the Money Mental Status Exam, they actually ask people to subtract from 100 by 7. And that's a pretty easy way to tell whether you're starting to see that impairment in somebody's, if you're starting to see impairment in executive function. And again, another obvious sign, disorientation. They don't know where they are, why they're there. They don't know what day it is. They don't know. Another one we use that's related to this would be, or related to memory. We ask sometimes people if they can know who the president is. Well, okay, who was the president before that? Who was the president? Can you go back 3 presidents? Can you go back 4 presidents? Who was the president when you were born? Can you name them? And it's really kind of interesting to see what people do and don't remember.